For yeah, Gillian, can you please go over and introduce the compendium for all of us?
Yeah, absolutely. So the compendium is the first clinician-only knowledge base for all of the different stakeholders within the ecosystem. And that is obviously the doctors are key, and the stakeholders such as suppliers, distributors, and pharmacists. There is no patient engagement in this compendium, and that is because the TGA obviously have made it very clear that they don't want any patient information to be shared. One of the most important things about the compendium is that it's detailed and it's filterable with advanced filters. And so at the time of a consultation, a doctor can see at a glance what is relevant to that particular patient, and be able to see all of the various different comparable products that might be similar but have different types of molecules that would enable them to provide the best use of the medication for their patients. Another big feature is that we provide a very much a detailed internal communication hub. That's very important for all of the MSLs that are out there that are trying to get in touch with doctors, and for doctors to, at the time of the consultation, perhaps ask a question that is relevant for them. So the compendium is free for doctors to use, and the suppliers can add their stock. And of course, the detail that we're talking about today is TrialKey's being able to search for relevant research involving medicinal cannabis products.
Thank you. Damon, can you please discuss what is TrialKey for those who might not be across us right now?
Yeah, so TrialKey uses advanced machine learning techniques to analyze clinical trials. And I guess there's two use cases. The first is that for any clinical trial that is ongoing, we can predict the probability of success and provide like a 95% confidence interval for that success rate. And the second use case is that we can help the industry actually design better trials. So improve that success rate by looking at the underlying protocols and using machine learning to optimize those protocols. So the model is trained on a lot of trials. There's more than 450,000 trials in our database. It covers over 100,000 conditions. So in terms of medical cannabis, we obviously know it's a new and emerging area of research, but there is a reasonable amount of coverage in our database. I think there's something like 1,800 trials that have been registered. So we can apply our machine learning model to those trials that are ongoing and estimate what the likelihood of success is. The other thing that we can do is look at those trials that are completed and provide some insights as to what the results were and the quality of the research that was undertaken for those trials that are completed. So our model's been extensively validated and tested, and our accuracy measures are our industry best. So we're very excited about the possible applications for TrialKey, and this one in particular is a great use case.
Thank you. And can you touched on it a little bit, but could you discuss the TrialKey database and how clinicians would be able to leverage the database for their own research?
Yeah, it's free at the moment, so there may be a paywall coming in the next few months. But for now, you can use that code there to get access. So we have this advanced search feature. So you might be interested in, say, a topical and how that affects anxiety and depression for this particular cohort of patients. So you can do those advanced searches in TrialKey, and it will return the trials that best match your criteria. And for each of those trials, you have the estimated probability of success at the time that the trial was registered. So you can do a bit of a deep dive and click into those trials and get some more information on them.
Wonderful, thank you. So last year, Opyl and the Compendium signed a partnership. Damon, could you discuss a bit about how the Opyl and Compendium partnership actually elevates clinical confidence in medicinal cannabis?
Well, I think the main thing that it can do is it can provide some transparency for a new and emerging industry. So, our approach is completely data driven. It's not using anyone's opinion on the pros and cons of medical cannabis. So we can, estimate trial success rates based purely on data. And I think providing that level of transparency, can help validate this technology, just a pure data-driven technique.
And Gillian, can you discuss how TrialKey's data actually integrates into the compendium for suppliers and for clinicians as well?
Yeah, so the slide that you're looking at there, it shows you on the top bar that we have introduced TrialKey as a direct connection to TrialKey. And all of this is really important because the doctor's needing to do this potentially at the moment that they're talking to a patient. They may research a patient before they see them, but it's not likely. Busy doctors are actually always in the moment. And so it has to be an efficient way for them to do a research. So having that integration button directly at their dashboard is the enabler for that to take place. The doctors are really looking for, and this is something that research is not sort of showing them at the moment, even though there's lots of studies out there. Unfortunately, the studies are showing or saying very generic terminology, and they're referring mainly to it just being medicinal cannabis. Well, as most of us know in the sector, medicinal cannabis is a very, very broad term. And so doctors now are looking for more about what the minor, cannabinoids and terpenes and molecules that are within the products that are listed on the market. So it's really important that when they're looking at particular research, that they can see that it's been tested on particular products and this is what the results are. So having a validated platform is probably key to doctors advancing their knowledge.
Thank you for that. And can you discuss specifically what this means for clinicians?
So for clinicians, having the ability to feel comfortable with more robust data and more current, up-to-date research and independent and transparent, as Damon said, is critical. There's a lot of evidence around that is ad hoc. And really, with what's happening in the medicinal cannabis market, it's so important for doctors to feel that they take this into the future of more respected medication, as opposed to where it is now, where I think a lot of the markets, government as well, are giving medicinal cannabis a bad name, and maybe perhaps that's true, but it needs to be brought into a far more robust method of research. The other thing too is that when doctors are searching for products, it's really important for them to drill down deeper, because a lot of the molecules and various different constituents that are involved in medicinal cannabis products provide them with an option to treat maybe a patient with a particular concern. And the compendium has the ability for doctors to also share their reported outcomes, and that's in a safe environment, so that's not shared with any patients, but it's just clinicians saying, I've been treating a patient with this particular condition, and they're also using this medication, and these are the effects or these are the outcomes that I've found on that treatment plan. So provided with the the more validated research, the patient will receive a better outcome because they're actually being able to sort of drill down and not stick to more of a surface level, sort of issue, so that they can feel more comfortable at the moment. But it's also for suppliers as well, and it allows them with some of the products that are out there on the market. It's very hard for doctors to gauge whether they're a product that is relevant for that particular case. And even on the compendium, we find that some of the suppliers have products listed and they don't list things like, certificate of authorities, and they don't put any research attached to it. So it makes it difficult for a doctor when they're in the moment of the consult to be able to provide, or really research a little bit further into what would be beneficial for that patient.
Thank you so much for that. Before we progress to the questions, I'm just going to briefly let in anyone that might be in the waiting room. Wonderful. Okay. So Gillian, what are the biggest challenges faced by medicinal cannabis prescribers today?
Well, the biggest challenge, I suppose, is the vast array of products that are on the market at the moment. And to give you an idea, as I was sort of mentioning before, time is of the essence with a prescriber when they're talking to a patient. The doctor is more concerned about, understanding the patient's issues. They don't have the time to be remembering all of the very minor, details of maybe a medication. So having a tool provides them with the ability to provide a better result for their patients. But the other challenge too in the industry is that there is a lot of product out there, but it's also that the products themselves are sometimes in stock, not in stock, and doctors, when they're prescribing, end up prescribing something that when it gets to a pharmacy might choose, because they're keeping stock of a product, to just offer a substitution to the patient without realising why the doctor has prescribed the original medication in the first instance. So that's probably two key ones. There's lots of challenges in this industry that we need to overcome, but there are a couple from a clinician's point of view that are faced today.
You touched on patient care briefly there. How do these challenges impact patient care and clinical outcomes?
Well, look, the products, as I said, they can be, I think at the moment there is probably 300 or 400 products available on the market presently that are in the flower category. What makes them different? So it's really being able to filter the differences. And that does make a big difference, because obviously the percentage of the THC, the CBD, and as I mentioned before, the minor cannabinoids and terpenes and any of the other, the various different molecules is important, because patients could have an outcome that is not desired, or they could have no effect at all, which is, and a lot of medicinal cannabis is a little bit of trial and error. So a doctor needs to stay in touch with a patient constantly to understand whether the product that they have prescribed. So it's really, I suppose, the uncertainty of the market in terms of what all of the constituents are in the medicinal cannabis. It's getting that amount of detail out. Research is necessary to be able to sort of assist the prescribers.
Definitely. Can you share any specific instances where a lack of information has affected prescribing decisions?
Because I'm not a clinician, I can't tell you of cases that I have. I don't practice, But the challenges would be more along the lines of, and a little bit of it's how the industry is set up. There's a lot of telehealth providers in the market, and they're essentially not their regular patients that are coming to that. So there's a bit of a divide between sharing of information between regular GPs who may have been treating that patient for some time in terms of, using traditional medications, and that hasn't been successful to the patient. So when a doctor that is specialising in medicinal cannabis, they are really having to start afresh. And so a lot of it is based on a short consultation in the beginning to understand the patient's history, and a history that could be quite complex. And quite often they don't have enough information before them in terms of, previous, prescribing habits of, to the patient, or results from any other specialist involved. So that could be, obviously, the doctors try in their moment, but the problem with that is it does impact the clinician's ability to probably in the first instance prescribe the right medication. But if you couple that with not knowing what products are out there and what they, I suppose, what the research is saying, then it does make it even more difficult.
You touched on earlier that the cannabis industry is still quite in its infancy, and there is quite a lot of hesitation still. What do you foresee are the trends that are shaping the future of medicinal cannabis in Australia, or even globally?
Look, I think that, there's a big market out there that's always been there on the opioids, and there's side effects on a lot of that type of medication. And like any medication, people become either, it obviously reacts with them on other treatments that they might be on, but this is an alternative, and it has been legalised as an alternative medication to those that have been on traditional medications. So, look, I think that the lack of information is coming out that it is new. I think that there's a lot of great research currently underway, and that will be very helpful. Obviously, the traditional pharma market has had decades of, centuries of being able to do research. So it's taking it from where it was, which was an illegal, lifestyle medication, to now making it a medical. And Australia is leading the way, I must say, in a strong clinical model, but it takes time. And I think that, we can't stress enough about having to run parallel to, doctors prescribing and sharing, clinician-reported outcomes, and the link between researchers that are undertaking these trials, because if they take trials on that cannot be validated, or they still present as a very ad hoc type of result, then it's not progressing the sector at all. So, I'm hoping that, the more time goes on, that we will see research, which obviously takes ages to go through the process, and that information, will again inform doctors at the time when they're prescribing. So it's really about sort of, I suppose, taking it from an illegal activity to a medical model. And I think the acceleration of that over the last, 6-7 years or whatever it's been now, has been remarkable. But, more needs to be addressed. And so, close connection to doctors and researchers is what's needed.
Of course. And the compendium does seem to be quite a valuable tool for clinicians to get their information that's up to date Could you discuss how misinformation, the lack of education, and of course, difficulty accessing information about medicinal cannabis affects clinicians in the industry?
Yeah, well, look, I suppose again, let's start at the beginning. So, how did people that were, early runners in bringing in, products into Australia start? Well, it's a very slow haul because they have to try and get in front of the doctors to tell them a very big message. And it's all new to most doctors. They've never been involved in their education training on medicinal cannabis. So they have to feel that what they're prescribing to their patients can be trusted, that it works, that it's been validated. And of course, peer review and evidence-based research is important for them. And they also have had maybe only a few suppliers in the early days provide them with information. Then I think when we first started, there was only sort of like a handful of products on the market. Now there's, I think, 1,500 products in this sector. So if you can imagine that the increase in the amount of products coming on the market is making it even more difficult for doctors to know what is the best for them to prescribe. So the compendium is designed to be a tool which is very easy to filter, as I mentioned before, but it's now it's not just about filtering on the basics, and the compendium can start off with, you can restrict what you do filter on, or if you're only wanting to know what products are available with THC and the percentage of THC in those products, you can do that. But as I said, the market has progressed, and doctors are now also wanting to know more. And that is where it's really important for, sponsors, suppliers to provide this information so that the clinician has the ability to research there and then at the time.
Thank you. I think that you have addressed the answers for the next two questions, so I think we can skip that one. So how does the compendium address these challenges for prescribers? Is there any specific features of the compendium that you want to specifically address?
Yes, there is, and of course it's a software. So without sort of really demonstrating it in detail, which of course I'm happy to do for anybody that wants to have a demonstration. So I'll just talk to the type of features that it does have. So doctors, when they're prescribing something that is new, it is as I said before, a little bit about trial and error in finding the right medication or the right type of medicinal cannabis type product for that particular patient. It's not as simple as just a one type of product will do. What we do allow is for the doctor to, as I said, to write the clinical outcomes, but that gets shared. And it also allows doctors, the compendium, to be able to put in on their patient some of their clinical findings. And whilst they might be, ad hoc to a degree for that particular patient, it does allow for the building up of data to be able to say that this product was used in a patient that is suffering from this condition, and that condition coupled with some other traditional medication has been successful because of this. So it enables a lot more information to be added to the products at the time, and this then gets shared with only those that really need this information, which is the clinicians. So that, plus a doctor will also, when they're prescribing, they might have a pain clinic, for instance, and they have a lot of patients that come in for back pain or knee pain or whatever it might be. So they find certain products terrific for treating patients. And once they do that, they add that to their favourites list. So one of the key things in the compendium is for the doctors to be able to develop their own, prescribing favourites based on conditions, with notes attached to it so that they can go back to it. But as I said, the advanced features are really important. And also doctors don't have time to read a lot of emails. And so having the communication system within it allows for the ability to talk to a medical service liaison officer out of a supply company, to be able to ask, okay, I'm looking at this product. Is this something that you would recommend? Or is this product that you have, which looks similar, a better solution? So having communication in a more direct fashion is very important, again, at the time for a doctor.
Thank you. So Damon, Gillian has discussed a lot of the challenges that are currently in the industry. How might access to TrialKey's validated reports influence clinician confidence in recommending certain medicinal cannabis products over others?
Yeah, that's a good question. We've done some research into clinicians as well, and like I echo a lot of what Gillian was saying around being extremely time poor, and that they might have an interest in medical cannabis but don't have time to get across the research. So you have those buckets of clinicians that are really engaged and they can find their own information. Then you'll have some that are probably just against it for whatever reason, but the very vast majority in the middle are just time poor. And being medical professionals, they're very scientific in nature, so they want information that they can access, that is reliable, and independent. So I think that's where TrialKey can come in conjunction with the compendium, so that we can provide that missing information in a very digestible manner, so that they, in their 15-minute consult times, they still have time to perhaps access the combined database to find what they're looking for. It might be a patient with knee osteoarthritis that's tried all sorts of alternatives and is just looking for something, or it might be, a more advanced search in terms of compounds and molecules. So, yeah, that providing that data that is on hand and easily digestible, I think that's where the two products can work really well together.
And what role does a third-party search tool like TrialKey actually play in addressing clinician concerns over therapeutic claims in the medicinal cannabis market, Damon?
Yeah, I think it's just a very quick way to validate information. So, for example, TrialKey, we have all of the trials that are completed and what the status is, and then, if a clinician wants to do a deep dive into the trial, they can see, at a glance how many patients were recruited, what the scale of the trial was. Was it 4 patients and a very low quality study, or was it, a multi-center high quality study? So that's the sort of I guess interface that we provide, is a search tool to be able to look at, the vast amount of information out there in a very quick time frame to make informed decisions.
And Gillian, what role does the peer collaboration play in actually improving prescribing practices?
A lot, in that I've mentioned that, we do have the clinician reported outcome for. That is the sharing within safe sharing. So clinicians, at the moment, there's sort of external third-party type patient sites such as Reddit, and patients are always, reading these things and becoming confused by, what the talk is, and they go off what, somebody says at Reddit, and yet they struggle with a clinician who may be new at at prescribing medicinal cannabis. The thing with the new practitioners is that for them to actually build their practice and build their knowledge, they need to be attached to safe peer knowledge base or communication centres. And I think that this is what we offer, is the ability for them to just ask questions to their peers safely. And without fear of being, legally taken into a case against a patient or something like that. And so what we're also finding is that doctors, when they're prescribing, when they're new, will have a tendency to just use one particular product because that supplier or MSL may have spoken to them, and that's all they think they will use. And that might be fine if they're dealing with one type of patient and one type of condition, or, it might be a supplier that does have a range of products, which is great too. However, I think that keeping that broader view so that the doctor can learn from this, and one of the other things that we haven't really spoken about is education. Is the education comes from peer collaboration. It comes from within those that are actually offering educational courses to build up their understanding on the products. And every time a doctor engages with patients, they're learning. But we believe that they need tools to help them in safe prescribing practices, because this is a very new and complex sector. So having this safe space is to accelerate the learning for prescribing safely.
And what steps can prescribers take to stay updated with the latest medicinal cannabis research and products? I'd like to open this up to both of you, Damon and Gillian. Damon, would you like to try to tackle this first?
Yeah, so I think the first item is just have a bit of an interest in this, and because it's a new and emerging field, is don't dismiss it and start to look at the research that's available and make an informed decision, because that's what prescribers do. That's in their DNA to evaluate information and make informed decisions. So tools like the Compendium and TrialKey combined can provide that information to them so that they can start to examine the merits of this emerging product, medical cannabis, and start to perhaps look at prescribing to patients once they get a level of comfort.
Gillian, is there anything you'd like to add?
Look, I think Damon's probably covered it, but in terms of staying updated, I suppose that's what the Compendium's design is all about. We provide an environment for anybody that is sponsoring a product or a supplier, meaning a grower, is the ability to add as much information as they can back to the doctor. And that includes like relevant research that they may have found. The other thing is too, on their product alone, we encourage the suppliers to add any YouTube or webinars or anything that can help a doctor in the moment on a particular product. And if I give an example of how we work, sometimes is I'll get a call from a supplier. I have a meeting with them for an hour. They tell me all about their product, and it sounds fabulous. It sounds like they've got great genetic strains, but by the time that conversation has gone, I've lost a lot of the important messages that have been told to me, and I'm not a clinician. So the clinicians need to know, and the difficulty is that most suppliers can't get in front of clinicians. So this provides them with an opportunity to stand out and really deliver or elevate this whole industry by adding relevant information that a clinician wants to hear.
And then in what ways can then prescribers actually contribute to the community within the compendium?
Okay, so the community being the clinician community is so the community of patients. I don't talk. Obviously, the clinicians are talking to the patients, but in terms of the community, they can add their own reported outcomes, as mentioned before, and that's a matter of building upon that safely, so that the clinicians will say, uh, these are the symptoms that I've found in this particular patient using this particular product. A communication can then take place between different clinicians, and that's another way of contributing, because clinicians feel more comfortable, obviously, talking with their peers and colleagues, and so it enables them to share in a clinical language as to what they've found. And most experienced medicinal cannabis prescribers, particularly when I've had conversations with Dr. Gail Herzberg, they're very happy to share their knowledge. And I think that that's where the compendium is helpful, because sometimes you can say, well, I would like to be engaged in that chat on that particular, doctor's issue, or whether it be something that they've actually found to be useful. And so it allows them to share it in real time and to have it relevant for them.
And last question. What steps can prescribers take to actually encourage suppliers to engage with TrialKey to make the validation available on the compendium?
Okay, so the steps are that a prescriber can at any time communicate with a supplier or a pharmacy or distributor, whoever is in that chain in the ecosystem. What they could ask while they're sort of looking at their particular product, they can say, do you have any research on this product? And have you got any? So they can ask for further evidence. And I think that's what is important, is that the communication can happen with the relevant person for that product. One of the biggest issues, as I've mentioned, is for the suppliers to get in front of doctors. And you might only have 15 minutes to talk to them while they're having their morning tea or lunch or something like that. So it's very hard to provide them with all of the information that is relevant about your product and the research trials that have been done, or anything else that might be useful for them. So I think in order for a supplier to provide clinicians with the best information, it's to possibly say that TrialKey, or we work with TrialKey, we can provide you with relevant research, validated research outcomes to show you that this particular product would be very useful. So I think that prescribers are ones that will drive this, because they're the ones that are wanting to elevate the whole market.
Yeah, I think maybe just to add to that, if you're a supplier and you're looking to get some level of validation, you might have run a trial where TrialKey could sort of analyze that trial and provide feedback to prescribers about the results and the quality of the study. Or if you're actually just in the process of undertaking a study as well, that's where TrialKey can help provide some information on the likelihood of success, which might encourage prescribers to maybe recommend patients to trials as well. So it doesn't really matter what stage a supplier is at in their research. I think the Compendium and TrialKey can help.
Absolutely. Well, thank you everyone for joining us today. If you have any questions, please pop them through in the chat, and Damon or Gillian are able to address them. But if you would like to learn more about the partnership, you can scan the QR code on the bottom right-hand corner. The recording of this session will be uploaded to YouTube and sent to all of those who have registered for the event.